More than 35,000 cases of monkeypox have now been reported to WHO from 92 countries and territories, with 12 deaths. Almost 7,500 cases were reported last week, a 20% increase over the previous week, which was also 20% more than the week before. Almost all cases are being reported from Europe and the Americas, and almost all cases continue to be reported among men who have sex with men. Vaccines may also play an important part in controlling the outbreak, and in many countries, there is high demand for vaccines from the affected communities. However, for the moment, supplies of vaccines and data about their effectiveness are limited, although we are starting to receive data from some countries. We remain concerned that the inequitable access to vaccines we saw during the COVID-19 pandemic will be repeated, and that the poorest will continue to be left behind. As we announced last week, a meeting of experts convened by WHO has agreed to rename the 2 known clades of monkeypox virus using Roman numerals. The clade formerly known as the Congo Basin or Central African clade will now be referred to as clade 1, while the West African clade will be called clade 2.
So we are not expecting 100% efficacy for these vaccines for the prevention of monkeypox. We don't know the exact information. What we're seeing are breakthrough cases, which are not really surprises, but it reminds us that vaccine is not a silver bullet, that every person who feels that they are at risk and appreciates their own level of risk and wishes to lower their own level of risk have many interventions at their disposal, which includes vaccination where available, but also includes protection from activities where they may be at risk, reducing number of sex partners, avoiding group sex or casual sex, and specifically when a vaccine is in fact administered, waiting until that vaccine has the time to produce a maximum immune response. In the case of MVA vaccine, this is 2 weeks after the second dose. So again, it's not a magic bullet. People do need to wait until the vaccine can generate a maximum immune response, but we don't yet know what the effectiveness will be overall.
Finally, on COVID-19. Over the past 4 weeks, reported deaths globally have increased by 35%. Just in the past week, 15,000 people around the world lost their lives to COVID-19. 15,000 deaths a week is completely unacceptable. When we have all the tools to prevent infections and save lives, we're all tired of this virus and tired of the pandemic, but the virus is not tired of us.